pipeline that supports use of image-based AI diagnostic tools in healthcare. We have two cores, the administrative core and the data management and analysis core. And of course, later on, we shall see the progress of each. The data management analysis core is central to all the research cores and the pilot projects, but also the administrative core takes up administrative issues, managing all the research cores and the pilot projects. We have two research cores, one on retinal diseases, that is MUDSReH, the multimodal database for retinal images in Africa. And then we have AVEMAP, which is looking at cervical cancer screening still within the region. We have a number of partnering institutions and investigators. Mbara University is the prime institution, and those are some of the core investigators. And then the sub-recipients, we have Ghana, Kwame Nkrumah University of Science and Technology. And then we had before the College of Ophthalmology in Kenya. There are some administrative issues. That is why it is highlighted in red, which could not allow continuation. And then we have MIT and MGH also as very, very important partners. Progress of MUDSReH, the retinal research. This is basically in Uganda. These are some of the sites where we are collecting data. And as you see, these are preliminary findings from the data that we have collected. They are very interesting, and researchers are soon writing up different papers from this data. As of February, we had 58,000 images, but of course, this has improved since February until now. We are now at 61,389. When the images are collected and the data, we looked at capacity building, first of all, in terms of labeling. So we did train residents, medical residents, to do the labeling or to support the labeling. And we tried to do an analysis in the different phases of labeling that we had. We realized that the accuracy of medical students versus the experts is actually not so different, or it's not so apart. And so it is very feasible that we can actually use medical students to support labeling. So those of us who are doing medical imaging research, that is a good avenue to look out for. MUDSReH has also an article that has been accepted for publication, and that is good progress on our side. Of course, development of algorithms and testing is earmarked for this year 4, and we believe that this will also go well during this year. For the cervical cancer image screening, we are looking at February. This was the total of images that had been collected and this number of participants. These had been labeled. And as of this month, July, this is the total that we have, and this is what has been labeled so far. There is great improvement in collection of the data and also the labeling. They're still analyzing the data, and also manuscript writing is ongoing. Ghana is so far working on 2 manuscripts, and also Uganda, they are working on 2 manuscripts. Similarly, also the algorithm development is to take place this year, and also testing in the different clinics and hospitals around to see how these algorithms work will be done within this year. We have 4 pilot projects, 2 pioneer pilot projects, which are recruited in 2022. One is on skin disease, dermatitis, and this is how far they have gone in terms of collecting images. They have labeled all their images. They are collecting roughly around 11 images. The previous projects are collecting about 8, that is cervical cancer, while ophthalmology are collecting about 4 to 5 images. The breast cancer team has also moved. These are the number of images they have so far collected, and these are the ones that have been labeled. And then we have new pilot projects which were awarded this year in January. One is on obstetric complications using ultrasonographic images. And of course, the other is looking at using chest X-ray images to also diagnose pulmonary complications. Both these teams have obtained the research ethics approval at institutional level and also the approval at the national level. The tools development is being finalized, and data collection will commence soon. The DMARC has been central, as you saw in the diagram, supporting all these projects, setting up the infrastructure and making sure it is operational, the documents required, the duos, the non-disclosure agreements, data request forms that researchers will use, companies and etc. The tools that are collecting data and labeling, all these have been locally developed, as well as the data portal, data dictionaries, and of course, I've participated in coordinating center meetings, field visits to support data collection have been very crucial, the DMARC, making sure that everything is captured with good quality and in order. Of course, capacity building has taken place. DMARC members have undergone several short course trainings at MIT and also in Amsterdam to support capacity to handle the whole setup. The admin core has been central in the administrative issues. Program implementation committee meetings have been taking place on a monthly basis. Sometimes the program officer attends, as well as the scientific advisory board members also attend these meetings. The scientific advisory board members have also been very, very crucial in supporting technically the co-investigators of MUDSReH. The admin core still supports all the logistics for the projects, the grant management support, and of course, work plan development, and making sure that the performance progress reports are submitted on time to the NIH. We are thinking that let it not be only about collecting data and coming up with data sets and then research, no, but it is time for us to think about sustainable data pipelines as elements important for Africa, because data sets quickly lose value over time. And this would require us also to strengthen our healthcare information systems. Most of the hospitals have no healthcare information systems, and these are yet crucial to support this establishment. Ethical use of AI is important, avoiding bias, very, very critical. Ourselves as Africans collaborating internally, but also keeping in mind the external or the international collaborations is important. Strengthening the data science infrastructure is key, as individual institutions and also the African continent. If you are dealing in research that applies artificial intelligence in diagnosing diseases using images of the retina, images of the cervix, skin images, mammography images, ultrasonographic images, and chest ray images, we are interested in collaborating with you. If you're a PhD scholar, if you are a master's scholar, if you're a clinical imaging research organization, and of course, any research organization, you can collaborate with us. Thank you. This is my personal email, and below is the MUDSReH email. You can reach out to us and we will get to you. Thank you.
Well, thank you so much for this presentation. I'm taking over from Gifty as the facilitator for this session. I hope you can all hear me okay. Does anybody have any? This was really great. Thank you so much, Fred. And I'm glad the pre-recording worked. I was a little bit nervous about that. I think Dr. Kagwa is online as well. So if does anybody have a question for the presentation or for the Data Science Research Hub program? You can, I was going to say you can type them in the chat, but I don't think we have our own chat. So this would be the entire group's chat for all the other breakout sessions too. So you can raise your hands if you have a question, and maybe I'll just get started. I was quite impressed by the number of medical images that are being analyzed. And I have two questions regarding to that. Number one, for per disease stage, do you use the same type of images, let's say X-ray or mammograms or others, or like do you use different types per disease stage? And then the second question, I guess, comes with that. What challenges, if any, do you have when you streamline the interpretation of those images and the disease states, considering that I guess many people are involved in reading the medical images? Dr. Kagwa, can you unmute yourself? I see you online, but I don't.
Yes, thank you. I didn't get, was it Gifty who asked?
Inka. No, Inka. Oh.
Oh, sorry. Yeah, Inka. The type of images, you mean the different image types for that we capture? We do capture JPEGs, PNG. I don't know if I got that right as your question.
No, I mean X-rays versus, I don't know, ultrasound and others. Do you use just one type of imaging methodology, I guess I should say, instead of image type?
And no, each of the diseases have different imaging technologies, and their technologies bring out different types of images. So our role is, for example, under the DMARC, we archive the different types. For example, when you look at the ophthalmology devices, they can generate PNGs, they can generate JPEGs. If you look at the mammogram images, those are also different. So the technologies they use are different. We're not using the same technologies.
So do you have, what are the challenges? So you have different people reading the images. Do you have this, does that sometimes pose challenges? Like I can imagine, like everybody interprets some images differently than other doctors maybe.
Yes, and now for the reading of the images, one of the aspects that we are looking at is, first of all, avoiding bias. If we find one category of people reading the images and making conclusions about them, we feel they may be biased. So the sessions we've organized, we've made sure that we have a variety of people in that if two people have different perceptions on the image, that image is forwarded in for adjudication. And so we get an expert who will give an expert opinion towards the two. So we have designed the tools in a way that when we are reading the images, the people labeling, each image is given to two people separately. They don't know that they're actually reviewing it, but after reviewing it or reading it, the information they give, the tool that we built automatically places it in another folder for adjudication if the reviews were contradictory. So that is how we are trying to deal with that aspect. that is specifically for ophthalmology. And then for cervical cancer has an already known method for verifying the information concerning the image. So when the two reviewers or the two readers of the images have contradictory remarks, then it is referred for a pathology test, because the pathology tests are usually standard and known. So the pathology test becomes the third comparant to the two contradictions, and so we take the other option. Thank you.
Thank you. Any other questions? I'm not sure if the chat is specific to us or not. Maybe it is. There's a question. So if you have questions, I think it might be easier to just raise your hands and we can call upon you. I don't see any hands raised. There's a question regarding images and storage requirements for those. And I'm assuming this is for this chat. How do you transmit images and storage requirement for the image data?
Yes, thank you for that question. Of course, the bandwidth issues are one of the challenges that we are facing.
Do we lose him?
Yeah, I can't hear Fred anymore.
Maybe just give him a moment to come back in, because I can't answer the question for him.
Twitter offline, it automatically syncs when they have internet connection, and in Uganda we're able to get the images uploaded, but the bandwidth issue is critical. The storage space, we have good storage space. Locally, we have a local server that we purchased, and each year we have been adding to the storage as the more images are captured.
Thank you. We lost you for a moment, but I think we got the message. So it's challenging, but you compensating by doing storage locally and then uploading to servers as well. I have other raised hands. Let's go by order from what I see. Lamek Rono. Do you want to unmute yourself?
Thank you. Thank you, Madam Lamek. The first question was already answered by Fred on the requirements for on how they overcome the challenges of transmitting the images, given that it's bulky and we have bandwidth issues. So I wanted to know if already they have thought of using the Starlink satellite, although it's just currently a little expensive in Kenya, and also the storage, which he has answered very well. So the second thing is, for myself, I come from the background of cybersecurity, but now also intersection also of data science. So I don't know if they are also addressing the issues of cybersecurity issues in this project, or is there a chance for us to partner? We can come in with the security elements, because the more data you gather, the more you want to make sure that they are safe, because I just saw ethical issues being touched. Thank you.
Yeah, thank you, Lamek. Yeah, possibly it's a good aspect that you bring forward. We are focusing on the cybersecurity issues. Yeah, personally, I am a cybersecurity person, and yes, we are ready to collaborate with you. We can link up as the mail I forwarded. Please let's link up and see how we can make it better.
Thank you, Frank. I will. Thank you so much.
Yeah, they were like Fred provided his email in the presentation too, which will be recorded, but I think you could also link up in the chat probably with direct messaging. I see another raised hand. Olum, I'm probably gonna, sorry for mispronouncing the name up front. Olumide Obolabi.
Yes, thank you, Olumide Olabi.
Thank you.
Right, I just want to appreciate the work that they are doing at their own institution, and I'm saying that because we are at the beginning of trying to use AI to do some diagnosis in a medical treatment. We have a collaboration with some universities in Nigeria, where I'm based in Abuja, Nigeria, and some in Europe, and we are doing this embedded AI course. Our own particular bent in the University of Abuja is for medical diagnosis and other uses, particularly cardiovascular cases in sickle cell. So the use of these AI tools to diagnose, to identify, and to do prognostication of these diseases. These are the things that we are setting up to start doing. We are hoping to start admitting the first set of students by September, October. So what I'm wondering and how I'm asking is, how do you set up this particular research to be able to use the data science methods in diagnosing the diseases, particularly those that interest us? The kind of setup you have, the infrastructure, and also how we can also maybe collaborate with you, get to know what you are doing, and so be able to properly set up our own. Those are things I'm wondering about. Thank you.
Thank you, Olumide. Your question requires some detailed discussion with you, but one of the quickest response I can give is we had to first think of a pipeline that we are going to look through, which will cover from the start. How does data come from the clinics or from the field or from the hospitals? How is it coming as a batch, or is it coming in live streaming? And then where is it going to be stored? And then how will it be de-identified? How will it be labeled? How will it be organized? And then how shall we store it? And then from there, how shall we link this to platforms where researchers can do research online, that is, do the machine learning, the artificial intelligence, and etc. So there is a whole big pipeline that we may need to discuss with you. And surely, yes, we are ready to collaborate with you, and we can assist you, take you through the different processes we've gone through, making sure that our partners are all involved and ethically involved and rightly to make sure that all partners participate rightly.
Oh, did we lose him again?
Yeah.
Right. I also
Well structured. Some of
Dr. Kagwa, you're like we're losing your audio. I see maybe Dr. Muavu Rogers, you from the DMAC at MUDSReH, maybe you want to add?
Yes, I just wanted to add on what Fred was saying. The collaboration is actually okay with us. Actually, we noticed that the kind of research they are doing, we could use some of the images that we already collected to identify some of those challenges, especially their main target of the disease, cardiovascular diseases, can be actually identified in some of the images we are collecting. So we could use that as a basis for the collaboration that could spur better research when we have them with a different data set that is coming from maybe West Africa. So we could maybe also compare data sets and the prevalences of the disease on the continent so that we can have a better data set for our population within Africa. Thank you.
Thanks. So I hear a lot of, it's great to hear that people are really interested in collaborating with you, and I think you already provided like a little bit of snapshot of what you could offer in the collaboration, but maybe, and I'm sorry, I'm jumping on you now since we lost Dr. Kagwa. Maybe you can give some information about, what a collaboration would look like. What could you offer to potential new research partners?
Of course, we are looking at augmenting our data set. So we are looking for partners that could offer data sets from different populations so that we can enrich our data set. That could be one way of collaborating. Then we are also looking for collaborators that could enrich or give more capacity in terms of maybe compute, because that is one field where we are a little bit understaffed, and also we don't have the infrastructure, for example, to do some of the computations. That's why we are striving to have an MOE. We are striving to have a collaboration with Google, so that they can provide such services. So we are looking for hubs and companies that could offer such facilities for us to do the research seamlessly, basically.
Yeah,
There
thank
is-
you, Rogers. That is interesting. I think I will be in touch and try to break down what we are about doing and trying to do, so that we'll see at what point collaboration could be possible. Yeah, thank you.
Yes, sorry, there was a glitch in terms of internet, and I moved off shortly. There is another comment in the chat concerning the DICOM. You realize there are few devices that actually do take DICOM based images, and most of the chest X-ray tools take the DICOM standard images. Most of the other tools, for example, the Nethra 3 cameras for ophthalmology and other cameras that they have, actually do not take the DICOM kind of images. So those that are doing the DICOM, yes, we take it up. And those that are not doing the DICOM, we are trying to see how we could try to fit them in, but otherwise, the algorithms mainly may not be a challenge, may not suffer a challenge of looking at whatever kind of image it is. And since we also want to break the barriers of far-to-reach areas which may not have tools that actually capture DICOM kind of images, then we stand a better generalization than only looking at the DICOM standard. Thank you.
Thank you. I see 2 raised hands, but for those might have been forgotten raised hands. Lamek, Rono, did you have another question, or is that from your previous question?
No, that was my previous question.
Okay, great. Okay, any other questions? for
Yeah,
Dr.
maybe I wanted to add on what Fred has said about DICOMs. So we also found a challenge with the DICOMs in a way that when you use DICOM devices, they tend to like take most of the information about actually the demographics about the patient, that de-identifying this kind of data set also becomes a challenge. Yet we're just starting AI in Africa, so it would be a challenge. So to avoid a challenge, we opted to use the basic kind of modalities that we are available and are known for our people. So we've seen that most of the data sets that are biased outside there, like in the developed world, were captured using devices that provide DICOM information. So in the process of training models, we've seen that AI algorithms are able even to extract out information that it was not intended to share. For example, we've seen that such data sets would lead to bias of letting out the gender and the place where this data set was collected from, yet it wasn't even given to the model. So gender, age, ethnicity, such things which lead to bias. So we decided to opt for the basic kind of tools that offer less information about the image, because all the information about an image, a DICOM image is a DICOM image can have all the demographics embedded within the image, most of the demographics. So we tried to do away with such devices, given the capacity in terms of expertise, in terms of de-identifying these images, so that we can clearly reduce on the kind of bias within our data set that we are collecting. Thank you.
Thank you. We had a hand raised in the, Samson Jarso.
Yes, can you hear me well?
I can, yes.
So wonderful. So, I should just reintroduce myself. Many of the people on the call are very familiar to me. I was a visiting professor to MUST for some time, and I'm here at Johns Hopkins now, and I'm moving back and forth. I just wanted to say I wasn't aware that some of these issues still existed, but I just wanted to say we at Hopkins can support many of these things. We have high performance computing, which is available to my MUST colleagues. And we have a lot of data engineering support for anonymizing DICOM as well as data sets. So I will get in touch with you, Dr. Fred, and check in with you again and maybe set up the meetings to start working on these things.
Yes, thank you, Samson. I remember your setup also in Kampala. Please, let's get in touch as soon as possible and we talk. Thank you.
Yes, and I'll just say one more thing also. I've got the research in the Cancer Center going in Kampala, but I'm moving some of the research over to Sakatini in Imberera. So we will be starting to collect prostate data with Dr. Sakatini. So I will make sure to loop in this group here so that the data will end up in these servers as well. Thank you. Out.
Yeah. Thank you.
Okay, any other questions? This is your chance. Oh, here we go. Perfect. Mandela Dedasso.
Hello, everyone. My name is Mandela. I'm from Ethiopia, and I am studying currently nuclear medicine, and I'm fascinated by uh, theranostics or this personalized medicine thing. And here in Ethiopia, I know this nuclear medicine thing is a very novice and it's very new for us, as well as the oncology, the clinical oncology unit and radio oncology units are specifically not more than 6 or 7 years. And so, but despite that, we have data that we can use uh, to model predictors and the like. And so I think we need some sort of, there is a knowledge gap. And I think there is a new initiative that just began to establish a data science department in School of Information Science at Addis Ababa University, I guess. And they do have a limited seat for educating citizens to do data science to health. So my question is, what are the possible ways that you can venture with the unit of nuclear medicine in Addis Ababa University and help us model certain predictors uh, with regard to cancer, especially the common ones here are thyroid and colorectal disease. Thank you.
Thank you, Bedaso. I have colleagues that are working on thyroid cancer. Recently, we were targeting an NIH call, though time caught us, we couldn't submit. Surely we can link up with you. They are quite experienced. They have been doing some good work. Yeah, we can link up with you and we see how we connect with Addis Ababa University, with also the new data science department, and we can share. We can build each other. Yeah, sure. We are available to collaborate.
Thank you, Fred.
Maybe, like considering all the, questions and wishes to potentially collaborate, maybe Dr. Carver, you can share your email in the chat so that people have it right there and don't have to go through the presentations. I think that would be helpful. Okay, do we have any other questions? I see two raised hands, but I'm wondering, are those from previous?
No, mine is up again. So I'm not sure, Mandela, if you're a doctor or not, or you're getting trained, but I'll just say doctor. So I'm in Addis Ababa frequently. Even though my adopted home is Uganda, my ethnic background is Ethiopian. So we here at Johns Hopkins would be glad to support the Addis Ababa University. We've been looking for contacts in Addis Ababa University for some time. So please give us your contact information and we will reach out to you.
Sure, Samson. I am currently specializing in nuclear medicine. My background is from medicine. I'm trying to write my email in the chat box, but I don't know why. It kept me blocking.
It's okay. We'll get there. I could write my contact to everybody.
Okay, thank you, sir. And here there is a big potential. Like, Ethiopia is a country for the second largest population with that we do have, and there is a lot of data. But despite the fact that the incompleteness of the data, but we do have a very large data, especially if you are from Ethiopia, a Black Lion Hospital.
I've been to Black Lion many times.
Yeah, so I'm a resident there right now, and we do have immense amount of data from oncology side, from our side, from hematology side, and the like.
Well, good. So we'll definitely come. I think things have calmed down a little bit. It's still difficult. That's what's been slowing things down in Ethiopia, but we're certainly here for you on this side. So we also have a team of Ethiopians here at Johns Hopkins would be interested in doing this work.
Thanks a lot. I will reach out through email.
Inka, I have dropped my mail in the chat. I hope it has been received.
Yes, I see it.
Yeah.
I hope everybody
Yeah.
else does too. I'm not sure about the chat functions. I think everybody should be able to enter items in the chat, but I also, Dr. Vidasso and Dr. Dasso, I wrote down that you'd like to get in contact. So if you have any issues, you can reach out to, I guess, me. Maybe I'll put my info in the chat and we can get you connected if that doesn't work otherwise.
Yeah, it should. I don't know. I am not sure. Yeah, but it should work for all. Yeah.
Yeah. Thanks, Egypti. I think we're almost at time. If there's one more question, we might be able to tackle it. Otherwise, I think, I don't know, like we can move back to the main room. Since there's no more time, I will leave to join another room. I think the next ones are getting started at 9 a.m. So thank you so much. Oh, we have Cesar Wisdom Favor raised a hand. So one last question.
Talking about we being spacey, but I'll just give you a small background. A data scientist by profession, and I'm trying to champion. I was given actual responsibility to champion that organization for data science within IPI. I'm just soliciting here for one collaboration and expertise people who understand data engineering for data science, because so many solutions have been provided, models have been built, but the challenge, we lack one, infrastructure. Two, data is not organized, and all these models to function and be beneficial to the population need organization of data. Anybody with such skill sets, they are well. I'll be so much privileged to link up with them, and we see how we can benefit from them.
Perfect. Thank you. I think there's lots of emails being dropped in the chat too, so you have ways to contact everyone. Well, thank you so much. This was a great session with lots of questions. I hope you all got out of it what you were looking for, and I think maybe we'll see each other in another chat room, another breakout room later today. Thank you to Dr. Kagwa and Dr. Rogers for asking and answering all the many questions. There was only one presentation, so you received all the attention and all the questions. And have a great afternoon, everyone.
Yeah, thank you, Inka, for facilitating.